All right, I'm going to demonstrate how to catheterize a male patient. I have prepared my kit the same way I did for the female. The only difference is you can see that I draped the patient with the fenestrated drape, and I laid the sterile drape over their thighs. Okay. Everything else is the same. So I need to clean the patient off. What I'm going to do is I'm going to hold the penis straight up. I'm going to take my first cotton ball, and I'm going to clean from the tip of the penis down the shaft, and I'm going to discard. And I do that 3 times. Tip of the penis, all the way down the shaft, and discard. Tip, all the way down. Discard my green thing, and I can take the tray off and discard it. This time I remembered to lubricate my tube. All right, and I'm going to turn it so that it's facing the perineum. Now you're going to hold the penis straight up and insert down. What we're doing is we're trying to get it away from the prostate gland. So I will insert it all the way down, go in. And I'm not touching the penis with my gloved hand. The contaminated hand is holding it up with the sterile hand, and this one doesn't want to go in any further. So I'm just going to have to say it's in. Oh, there we go. Okay. It's going in. You're going to go in 3 to 4 inches into the male penis with your tube, and this just does not want to go in. So I'm going to say I'm already in. I see urine. So I'm going to take my fingers, just like I did with the female, and clamp the tube. I'm going to insert the balloon. Okay, and I'm going to put all the water in it. Okay, once all the water is in it, I can let go of that because it's already inflated. The balloon is holding the catheter in place. I'm taking that off, tossing that. And I do exactly the same thing with the bag. I set it on the side. Now for the male, and I don't want to tear this, I'm going to just pull this down. You would tear it. But I need to reuse that. You would tear that off there. For the male, you don't put it on the male's leg because the penis may flop to one side and it would pull it. So for the male, you're going to anchor it on their lower abdomen because most penises will become flaccid and they hang one way or the other, and this way it's not pulling on the tube as it moves. If you had it on the leg when it turned, it might pull. So for the male, we anchor it to the lower abdomen. For the female, we anchor it to the leg. To remove it, do the same thing. You get your clean syringe, all right? You tell your patient what you're doing, empty the drainage bag, put this in the filling port. This is a clean technique to drain, right? And you're going to tell the patient, after you get the water out, you're going to get all the water out of it. Okay. All the water out. And hopefully it's out. Okay. Disconnect it. And you're going to have a tissue or something just to catch drips. Tell the patient, take a deep breath. 1, 2, 3, and we're out. And that's how quickly it comes out. Okay? That's the male catheter.